The Improvers Network that we're launching today is an initiative as part of the leadership, culture and capability work of the Patient Safety Collaborative in KSS. The idea behind it is to create a large family of improvers across the 3 counties and provide a safe space in which people can share their ideas and their problems about how to make quality improvement more effective.
It's been really good, really interesting, entertaining, informative. I think it's really useful for anyone involved in improvement work or trying to make things better in the health service to come to this sort of event. It gave me some interesting ideas and some people to network with to try and improve what we're doing in my organisation. Essentially we're all trying to do the same thing, and it's much easier if you know somebody else to work on it together and to get more ideas.
What's different about a community of practice is that we're taking down the boundaries of organisations. We're bringing everyone together, and the NHS is in danger of becoming a little bit silo-focused and not necessarily sharing information. But what we want to do is to bring all that experience that's out there together to form a community of learning, and this will develop and co-design itself as it goes.
So I lead a campaign called Sign Up to Safety, and part of that campaign is about helping people talk about what they know about keeping people safer. And we've used lots of different methods and tools and tips for helping people simply talk to each other, listen to each other and respond appropriately. We simply have a table and people can come and join and just simply talk to each other and hear what other people are saying, hear their ideas, the joys of the work that they do, but also the challenges that they face, and actually be helped along the way.
I've been talking at the Improvers Network today about public and patient involvement, talking about why it's important and getting lots of reaction from the audience that have been to the sessions around why they find it important, what they want to contribute to the future of health, particularly big opportunities around sustainability and transformation plans, and thinking of a new way of involving patients, public and carers.
At the Academic Health Science Network, we're thinking about how we can engage patients at that strategic level and making sure that those people who come to those discussions at STP level and more strategic levels in the system are equipped with the right skills and understanding. So we've developed a programme called Patients as Partners for Improvement, which will enable patients to develop those skills at a faster rate than they have been able to before, and work with us on our improvement work streams within the Academic Health Science Network, but also more widely across health and social care.
So people ask what human factors are, and there's an assumption that it's this politically correct nonsense about checking boxes and ticking boxes, which is related to pilots and doesn't have an impact on patient care. I would fundamentally disagree. Human factors is how we work as a team at 2 in the morning when we work with people you don't really know, and how you're going to get that optimal care for patients. There's loads of different aspects of human factors which people don't really understand, and when you start to explain it and put it into context, people realise that that is what makes a difference to patient outcome, rather than more facts and more knowledge and reading more journal articles.
What human factors is about: judgment and decision making, leadership, communication, teamwork, empathy and compassion. Something which is completely forgotten about what human factors is. And it's about the behavioural and cognitive skills over and above the technical skills. And we've shown evidence that it's starting to make a big difference.
Really pleased to be here today to support the Improvers Network event. It's really great to see so much enthusiasm for sharing and a willingness to improve things. The theme for me has been around sharing, lots of conversations about opportunities for people who are part of the Improvers Network, some great speakers and great discussions around communities of practice.
So we've had a fabulous day today, and the energy in the room's been really good, and we're keen to take that forward and create local chapter meetings for the Improvers Network to make a difference to patient safety.
So as the Director of Improvement for the Academic Health Science Network, it's my job to oversee the portfolio of work that we do in quality improvement and patient safety. We've seen a lot of examples of best practice and ideas being shared, thinking about how we can work differently to tackle some of the challenges that exist. And I think, it's a real testament to the hard work of the team and to the hard work of everybody who's made the time to come here to learn, share ideas, and look at new opportunities to improve patient experience and improve the health and well-being of the population which we serve.
I've found the day very relaxed. It's been very engaging. It's got a nice feel about it. The lectures have been really interesting. It's been a nice mix. So I've thoroughly enjoyed it.
Much of what I've heard today is new. It's aspirational rather than widely in practice.
Yeah.
But the motivation seems to me admirable. I would certainly recommend this event. The ideas that I've heard this morning, or this afternoon indeed, have been really illuminating.
I would recommend today and this kind of event to my colleagues and anybody really that works in healthcare. I work in an acute trust and I've met people from primary care, there's people from secondary care here, we've been able to network. You can embrace everybody's ideas and everyone has a similar mindset. So it's really good to come along and get involved.